This is Dr. Craig DeLisi. Hi, Doctor.
Hi, Gary.
You have no idea what we're talking about, do you?
Not even a clue. I've been trying to guess.
That makes two of us. No. I came across a study. Now, it hasn't been peer-reviewed yet, but as more and more states decriminalize marijuana, a study came out and actually associated with daily use in heart disease, an increased chance of having heart problems. Are you aware of this study?
Yeah. Well, I didn't see the study, but I did see a news report about the study.
Okay. And so potency, that has changed. Your thoughts overall on some trends we might see as more and more states opt to go ahead and decriminalize?
Yeah, it's a big question. I think we're finally learning because it's become decriminalized and legal at every level in different states. I think we'll see more things like this. Now, I don't know the nuances of the study on heart attacks per se, but it wouldn't surprise me, just like any other, mind-altering medication that causes any level of impairment, that it could have, it will have physiologic effects on the body, especially when used regularly. I have concerns about the regular, casual, recreational legalization of marijuana, and the reason for that, because I think a lot of people just say, well, it's similar to alcohol, and if anything, we know that having one or two drinks might even have heart and health benefits. Is that unlike alcohol, where you can have a drink or two drinks and not have any degree of impairment, I think sort of built in to marijuana, even at very low usages, is some degree of psychological alteration and impairment. I mean, that's why people do it. And so I think that has potential for a lot of effects. I know a lot of psychiatrists who think it's a terrible idea. They have concerns about it being used regularly across the population from a mental health standpoint. I have friends in Colorado where it's been legal for some time, and they live in a smaller town, and they said that the productivity of the town as a whole seems to be greatly decreased since it was made legal.
But the restaurants are booming. No.
Yeah, that's right. Yeah, that's right. That part is, and they can't find anyone to work in the restaurant. But everyone's hungry. So I don't know. And I think partly we don't know what we don't know, but it won't surprise me. And I think it is wise to kind of understand what we're getting into. I mean, nicotine and certainly cigarette use, goodness gracious, I mean, it's been studied so much. I mean, we know exactly what it does and doesn't do, and what the negatives are and the risks. And so I think when people smoke or take up smoking or continue smoking, they know that, hey, I'm really, I have if I do this for my lifetime, I have 90% chance of having emphysema, probably 10% chance of having lung cancer, really increase my risk of heart disease, and then this laundry list of cancers. I think for marijuana, we don't know that. And I think one of the challenges is that there are some actual health benefits that are legitimate for it. I mean, I think certainly in terminal cancer and to help stimulate appetite and for nausea, I think there's potential for seizure disorders. And in Texas and many states, they do allow, like I said, prescribing. Doctors have to enroll in a compassionate use program, and to give it to patients, they have to have one of, I think it's around 40 diagnoses, and then they get them from a dispensary in the state. There's several, and I think the options in the dispensary are mostly just chewable, edible gummies. So it's controlled and measured, and of course that's the other thing is that in recreational use there's no regulation or measurement. You're just usually smoking whatever you get your hands on, and that varies. The amount of THC that's in the marijuana plant, and so I do have concerns. I'm not a fan of that, and despite the fact that there are potentially benefits, I think the average person using it won't be using it for those reasons, unfortunately, and. So it's a big question. I think really it's a diamond with lots of facets that have to be looked at, before states make those sort of decisions. Unless at some point, which I assume will happen, is at the federal level, they'll probably just trump all the states and enact something that decriminalizes it everywhere. But I have a sense that will be to our detriment as a society overall, and not to our benefit.
That is Dr. Craig DeLisi with the Family Care Center, Titus Regional Medical Center, and this was not planned. But I'm segueing into kind of an awkward transition, talking about a substance issue. Our next song. It's a brand new song from Dylan Carmichael. I did not plan this. It's not. It's not about marijuana. He's got drinking problems. So very awkward segue. I appreciate you joining me. Here we go with the awkward segue. Here's new stuff from Dylan Carmichael.